Okay. All right. Good evening. Good evening, everyone, and welcome to ATP Live Monday. How are you doing today? I hope you're well. I am Gbemisola Boyede, and I'm here to answer any questions that you may have about the health of your children in the next 1 hour. So you're all welcome. Um, Before we start, I think we just need to share the video and make sure everybody can see and everybody can hear us. So I'm just going to do the same, and I encourage you to do the same as well. So I'm going to share the video and pin it to, okay, let me just so them. All right, so let's share the video. Let's invite everybody to be part of today's ATP Live Monday. Welcome back from our breastfeeding week. It's been a wonderful week. All right, so today we just take any questions that you may have about the health of your children and try and answer them in the next 1 hour. All right. I'm also trying to share as well. It's on Instagram. Welcome to ATP Live Monday. Uh, I'm trying to share the video to all our platforms, so you're welcome to join us soon. Okay. If you have questions that relate to the health of your children, you're welcome to post the questions now. Please always start with the age of your child and try and give us a brief summary of why you're asking the question and at least what you want us to do with your information. Try and give us the relevant information as well. For example, if you're asking about weight, child not gaining weight, or that, you need to give us the birth weight, the current weight, and all that. So that's what we would minimum. So any information that you think is relevant, but at the same time, let's not just make it concise and straight to the point. So you don't have to tell us the whole life history of the child, really. Okay, I think I'm done with the sharing. Okay, just to make sure they are pinned now. And for those who are watching us for the first time, do you know you can watch all the past episodes? If you want to watch all our past episodes of ATP Live, you can actually watch them. They are always on our page, on our YouTube channel, on the group. So it's always there. We don't delete them. And if you do want to watch them without interruption, I would recommend going to the YouTube. If you're an Instagram person, our Instagram live page, it's always have those Instagram TV, I think. Yeah, you can watch it there as well. So the videos are always there for you to watch. So if you are watching a repeat, I also want to welcome you. If you're watching a recording, like you're not watching live, so if you're not watching on a Monday at 6 p.m. Nigerian time, you are likely watching a recording. So that's fine. The only difference for you if you're watching a recording is that you can't ask your questions live because we are no longer there at the time you're watching. But what you can do is to post your questions to our Facebook group. So we have Ask the Pediatrician Facebook group that runs Mondays to Saturdays. So you can always post your questions there, and we can now answer your questions uh, on our Facebook group. So, but if you have questions now, if you are live, you are watching on Monday 6 p.m., you can ask now. But if you are watching the recording after the live session, you can always post that question to our Facebook group Mondays to Saturdays, 24 hours daily, and somebody will be there to answer your questions. We may not be able to answer your questions straight away, but we'll try to do our best to answer it within 24 to 48 hours. So, but if you don't see any answer in 72 hours, you are welcome to ask us why your questions has not been answered. All right, I think I'm done with all the sharing and I can now start to answer questions. So if you have any questions, so let me welcome everybody again. For those who have joined us while I was busy doing all the sharing, welcome to ATP Live Monday, brought to you by Ask the Pediatricians Foundation. Ask the Pediatricians Foundation is a non-profit organization that is completely devoted and committed to your children's health. And so, welcome. We do a lot of health education, information online. We have several social media platforms. We have our Facebook group, Ask the Pediatrician Facebook group. We also have a few other groups like ATP Family for Adult Questions, First Time Mom group. We also have the ATP Silly Mom for those who have suffered one loss or the other and need some psychological support along their journey. So all these groups are available for you. We have our website where you can read articles, see all our past events. We're on Instagram, we're on YouTube, where you can watch all our past videos, and we are also on podcasts as well. So where you can listen and watch as well. You know any of our previous teachings and also programs like that. So we are very massively available online to support you in your journey in raising healthy children, because we count you as our worthy stakeholders in reducing the deaths of children, especially in Nigeria. Beyond what we do online, we're also available offline through with our community outreaches to schools, to communities, and all that. And I'm sure some of you we have been to a community close to you. So that is Ask the Generations Foundation. And so today's program is just one of our programs, and I'm here to answer any health related questions that you may have about your children. So we'll start to answer the questions. A little bit of housekeeping. Please start every question with the age of the child. Please give us the relevant, pertinent information and keep it short and simple as well. So, those are just a few housekeeping so that we can move quickly through the questions and then we can answer as many as possible. And if you still have questions after the live session, because I have only about 60 minutes to answer questions live, you are welcome to post the question on our Facebook group and we'll answer them as well. So thank you so much. So I've got a couple of questions on Facebook. I will just go to that. And for those who are watching the shared link on the groups, you have to click on the video to ask questions. But if you are not asking questions, you can just watch the video. That's okay. But if you want to ask questions, please make sure you have to click the video. If you put it just as a comment in the group, I won't be able to see because Facebook has made it difficult for us to share directly to the groups. Okay, enough of all my announcement. Let me go straight to answering the questions, which is my business here. Faith Okon, good evening, ma. What makes a 3 months old baby to keep eating her fingers? Okay, you mean baby put the fingers in the mouth? Okay, well, I'm not really sure whether eating the finger is the appropriate way to describe it, but it is a normal behavior for children to put things in their mouth and to suck on the fingers sometimes. So it is part of development, and usually what we normally recommend that you must be very attuned to your children's cues for sucking. So usually when children want to suck and there's nothing to suck, then they begin to suck on their fingers or some suck on their toes as well. So the most important thing is for you as a mother to quickly recognize it so that they can you can breastfeed the child so that the child does not have to start sucking on the fingers. And also, sucking is something children find pleasurable. So most time children don't only suck because they are hungry. Sometimes they suck because they to suck. So that's why some of them in the process they just their finger gets into their mouth and they start sucking on it. Also, sometimes some children use it as a way of soothing themselves, like when they want to go to sleep, they want to kind of soothe themselves to sleep. So sometimes they suck on their fingers as well. So what you can do is to try and figure out what is the child needing. Is the child hungry? Is the child needing to be soothed? And try and do it. But the good news is that most of them will also stop doing it as they get older as well. Though we know some children will be, they have it longer, and even as up to 3 4 years they're still sucking. But usually we just encourage you to find them something different that they can play with, something has to do with their fingers, and the chances for them to put this in their mouths will be less. I hope that's helpful, Faith. Thank you. You are welcome to give me a feedback on the answer I give. If you want to ask more questions or clarify, you're welcome. Instagram, you're welcome. Please ask your question. I can't see any question on Instagram yet, but I can see you. Ofakasi, Sherry, Philip, thank you so much for your kind words. Okay, so your question: what causes frequent temperature in toddlers? Number one, toddlers should not be having frequent temperature, so there's nothing normal about any toddler having frequent temperatures. So, and I hope we're speaking the same language. In other words, when you say temperature, you are talking about high temperature and you're talking about fever. So sometimes I always like to be sure that myself and parents were on the same page. So first and foremost, I want to assume you're asking about children having fever, and I hope you know what fever is, because it is not just because when you touch your children they feel warm to you, that means they have fever. You need to get a thermometer, you need to measure it, and fever is anything above 37.5. So that is number one. So let's establish that fever is when the temperature is above 37.5 using an objective measuring instrument called a thermometer and not just our fingers. Number two, it is not a normal thing. It's not something that children should have frequent non-stop fever. No, it's not normal. So if a child is having fever, there's something causing the fever, and it's our job as doctors to figure out why. Okay, number one, why should the child even be having fever at all? And then when you now say frequent, non-stop, then it's becoming more alarming for us. So number one, the child should not even be having fever. Then the child having fever, there are many causes of fever, starting from our obvious in Nigeria. Number one is malaria. But there are many other things that can cause fever in children, including infections, viral infection, bacterial infection, fungal infection, other germs, and the infection can affect virtually every organ in the body. So you can have ear infection, you can have eye infection, you can have uh, respiratory infection, you can have diarrhea, you can have infection in virtually any organ of the body, and that can cause fever. And there are other illnesses too, not only just infection. There are other illnesses that are not so common, but they can also present with fever, even something like cancer as well. We're going to the real stuff now. So there are many causes of fever in children. Most mothers just always assume malaria and they treat the children for malaria. But if your child is having fever that is continuous, that is persistent, that is non-stop, you really need to see a pediatrician, because we need to do extensive investigation to know why the child is having fever, because it is definitely never normal for a child to have fever. So your 18 months old should not be having fever. And it's okay if your 18 months old has stopped breastfeeding. We want them to breastfeed for 2 years and beyond, but it's okay. 18 months is not bad. But the fever has nothing to do with whether the baby stop breastfeeding or not. So obviously, breastfeeding longer will protect the child, but your child having fever continuously, you need to know why, and we need to address it. So If you have not seen a pediatrician yet, that will be the first thing I'm going to recommend. I think last week I actually talked on fever. Our ATP hour last week was on fever. So if you have not watched that, you may want to watch that. It's still available on whichever platform you're watching. I think you're on Facebook. So just watch that, fevers in children. We went into details about causes of fever in children and what to do, and that may be helpful. All right, but definitely not normal. Definitely needs to be evaluated. All right. Next question is from Rauf Oluwatosin Odejobi. Help me, doc. My 2-year-old son is having tiny rashes that has refused to go for over a month. Okay, this is one of those questions that we need to see before we can answer. So we need to see these tiny rashes, okay? And if a rash has been going on for a month and it's not going, we need to know the cause of the rash. We need to know the type. We need to know the cause, and then we need to know. That's what will help us to know how to address it. So, you can see either a doctor, a pediatrician, a dermatologist. They can see the rash for you, and then they'll tell you. Some rashes don't. A lot of mothers, when people, even on ATP, I too know mothers, when people pose questions, even before the doctors can answer, people are right telling them, go and use this, go and use that. And I'm like, seriously? That is a very wrong approach. And if you are one of those mothers who do that to your neighbors, please repent. Okay? You should stop doing that. You don't just tell people to go and buy this cream or buy that product just by looking at your rash. There are more questions that doctors ask. And when we ask those questions, we're trying to figure out the cause of that rash. Some rash don't even require treatment. It's as simple as stopping something. Maybe you're using a particular product, a cream or powder, a soap or even food that the child is eating, and that is what is causing that rash. All you need to do is to stop it, and the rash will go away. It's as simple as that. Some children have itch rashes. It's just about making the room cool, making the house cool. Like the weather is so hot, and the rash will go away. So it's the most important thing about rashes is not people rushing to tell you go and buy this, and a lot of people always ask us that, what should I use? What should I use? That's the most frequently asked question when people ask about rashes. No, the question is not what should I use. The question is, why is my child having this rash in the first place? What is the cause of the rash? Because it's that cause that will determine the treatments. So if your rash is all over the body, it is persistent, then it's telling us, oh, this may be something. Could it be allergy? Could it be something that is obviously affecting the entire body and not just a particular area? So, um, Oluwatosin, I recommend that you see a doctor, and definitely any rash going on for 1 month, you need to see a doctor, and then they will take it up from there. I hope that's helpful. All right, I'm intermittently checking Instagram to know whether anybody has a question. So if you have a question, ask. No question yet. All right. Faith Okon is after eating, she does the same. Yes, I've already explained to you that there are many causes of reasons why children put their hand in their mouth. It's not just about hunger. It could be soothing. It could be, it's just something they find pleasurable. It could be something they use to soothe themselves to sleep and all that. So I hope you got all the information. But if you missed part of my explanation, you may need to watch the video again, and then you will get that explanation as well. All right. Let's go to the next question. Akiode Olaide. Good evening. My 6 months old baby sometimes have warm hands. Okay, just the unfilled one. I mean, there's nothing wrong with that. So if your child is hot, sometimes you start feeling it from their hands. So you may want to check how dressed up is the child. So some of us will wear too many layers on the children in the hot weather. So if your child's hand is feeling too warm, you may want to reduce the layers. If the child is wearing double, triple layers, you want to shed off some of them and all that. So there's nothing wrong with warm hands. It's just a reflection what is going on. If you are worried whether the child has fever, just get your thermometer and check. The thermometer is normal, it's fine. So usually when children are going to lose it, they first start with their hands and their feet. And that's why we normally when we want to feel whether a child is cold or not, we actually feel their palms and their feet. So if those areas are cold, then the child is really cold. If they are warm, then maybe the child is getting hot. And that's why children for will sweat, on their palms and their feet as well when they are hot, because they can easily lose the heat from that. So there's something to worry about. So that is just about that. All right. I don't think I have any question yet on Instagram. So for those who are just joining us, welcome to ATP Live Monday. ATP Live Monday is a program where you get to ask any questions that you may have about the health of your children, and we will try and answer them as soon as we can. So, I still don't have any questions yet here on Instagram, on Facebook. So feel free to ask your questions and we will answer them as soon as we can. And remember that even if you mix, because some people always come late and they're like, oh, I'm just coming, I just coming. We understand that. So it's fine. For those of you who are just coming, who are watching the recording, it's okay. You just watch the recording. If you have questions, if you are watching the recording, please go to Ask the Pediatricians Facebook group and you can ask your questions there and we will answer. All right, I have a question from Fawn Hedidia. Good evening, doctor. I want to do exclusive breastfeeding for my baby. That's a very good decision. Well done. Please do it. That's the best way to actually feed your baby. Is it advisable to give the baby drugs? No, your baby does not need any drug. Why do you want to give your baby drugs? So I get a lot of these questions, and in fact, some mothers get upset when they leave the hospitals and the doctors have not given them any drugs, and they were like, they didn't give my baby any drugs when we are going home. And I think we need to understand that your children do not need drugs. The children don't need drugs. You don't need any drugs. uh I don't like the word, but people tend to call them routine drugs, that these drugs you have to give to children because they have been born. No, nobody needs any drugs. All they need is that breast milk. That's all their drugs, all their food, all their water, everything is in that breast milk. So you don't need to give children any drugs at all because they don't need it. They don't need it at all. So most of us will say, oh, when we leave hospital, you want, should I give my baby ampiclos? Should I give my baby Nospamine? Should I give my baby Bomoro? Should I give my baby Bona Babe? All those things, please do not give them. They are absolutely unnecessary. They are dangerous and they are harmful to the children. So children who need drugs are only children who are sick. If your child is sick for any reason, the child has sepsis, has some other infections, and the doctor prescribe a drug for a particular reason, yes. But if your child is not sick, your child is well, then there is absolutely no basis for giving the child any antibiotics or any drugs whatsoever. So, fun, very good decision you've made to breastfeed your baby exclusively, and your child does not need any drug. And exclusive breastfeeding, just in just to remind us, because we just finished breastfeeding week, is just giving breast milk only. Because a lot of mothers ask us questions and they will say, I'm doing EBF, I'm doing exclusive breastfeeding. And then the next way they ask question, or the way the comment they made, you wonder like, do you understand the meaning of exclusive breastfeeding? Like some will say, oh, but I'm giving water, or and that is not exclusive breastfeeding. No. So a lot of Nigerian mothers think exclusive breastfeeding is just breastfeeding, and as long as you're breastfeeding, you are breastfeeding, and no, it's not. If you are exclusively breastfeeding, it means the word exclusive is so important there. It means you are giving breast milk only. Breast milk only. That's the definition of exclusive breastfeeding. Anything more than that is not exclusive breastfeeding, and what we want is exclusive breastfeeding. So breast milk only, no drugs, no water, no food, no formula, nothing else but breast milk only. So that's what you should do, and that's the best way to feed your baby. Okay, all right. Let me just check on our groups. I hope nobody's putting questions under the group and expecting us on side. All right, so please ask your question. We still have about half an hour to go, a little bit more over half an hour. Okay, and we will answer it as soon as we can. Instagram, ask your questions. Facebook, ask your question. And if you don't have any question, no worries. um, And just to remind us that apart from the question and answer sessions, Thursday is the teaching section where you can get um, you can get a teaching on a particular topic. And I doubt there's any topic in pediatrics that we have not talked about. We've talked about fever, growth in children, immunization, all the common conditions. We've taken them one by one: fever, pneumonia, diarrhea, meningitis, all those conditions. We've talked about them one by one. And if you have any particular one that you still want us to talk about, feel free to send us a message on Facebook, on email, askpediatricians@gmail.com, and say please address this topic, and we'll try and address them as well. So, but that is where you can learn a particular topic, or you can also go over to our website. Currently undergoing some upgrading, but I'm sure we should be done by the end of the week, and then you can read up some of these topics as well. So I hope that's helpful. Okay, I'm checking. No question on Instagram, and no question on Facebook for now. Today's a very slow day. No, that's fine. Yes, many people are still busy, maybe at work and all that. No worries. I'm sure they can always watch the recording afterwards as well. Let's just remember all the things we need to do. Now the children are on holidays. I really just want to encourage us to keep an eye on the children. I particularly was seeing a lot of worrisome updates on Facebook. At least in the last, it's like almost every week I come to Facebook. There's a teenager missing, whether from church or from, and it's giving me concern. I know the teenagers tend to give us the impression that they are big and they are now adults and all that, but they are still children. So please, let's not just leave them alone and think they can sort themselves out. There are bad and wicked people out there. So please, let's keep an eye on our teenagers during these holidays. Let's know where they're going. Let's know who they are with. Let's have some security. Let's also teach our children security consciousness. If anybody is trying to take them, let's if possible, we can have trackers on children. You can give them phones. You can give them something that you can use to track them. It can be in their bag. It could be a wristwatch. I think we really need to be waking up to that reality now. So let's have things on our children, in their bag, on their wristwatch, on their clothes, on their bodies, that we can use to track them if anything happens. Especially, it's very important. I pray God will keep our children safe. Okay, I got a question here by Omobola Uju Banire Abiona. Good evening, Doc. My baby was born 2.5 kilos. Okay, that's the normal birth weight. And she now weighs 6.5 at 12 weeks. Hope all is well. All is perfect. All is well. That is perfect. Your child is like a textbook baby is gaining about 1 kilo every month, and so your baby is doing well. That's Your baby is actually following the textbook and reading it and gaining weight as according to our our textbook. So I hope you are breastfeeding, Omobola. I hope you are doing exclusive breastfeeding. Tell us. But your baby's weight is okay. We don't have any concern about your baby's weight. So keep the good work going. And I hope your baby has gotten all the immunizations. So your baby will be due for another immunization in 2 weeks. That's 14 weeks immunization. So remember, don't forget that. Yeah, but your baby's weight is absolutely spot on. And while we're on that, we get a lot of this kind of questions. So let me just teach you how you can actually figure out how your baby's weight is okay by yourself. You don't need to ask a pediatrician that kind question. You yourself, you can figure it out. These days, we live in the generation of apps. Yeah, all of us are using smartphones. So there are a lot of baby's weight monitoring apps. Just Google it on your Play Store, Google Play Store, iPhone, whatever stores. Just check and look for any of the weight apps. So the advantage of those apps are once you put your baby's weight, their age or date of birth, and the day the measurement was taken, it automatically comes back to you and tell you whether it's normal or not. So if you are using a smartphone, you can actually have it on your phone and you quickly check for yourself. That is the high tech or smart way to track your baby's weight. However, for those of us that are old school, you have this immunization card, baby record card. They call it different names in different places, but bottom line, all of them has information where they sign your baby's immunization, and they also have a section like a graph, and they have lines on those graphs so that each time they weigh your baby, they're supposed to actually plot the weight on that graph. So you will see whether your child's weight is in between the lines. So there are about, some may have 3 lines, some may have 5 lines or even more. But the bottom line is that there's always the lowest line and there's always the topmost line. And your baby's weight must always fall in between those two extreme lines. So if your baby's weight is in between the topmost and the lowermost line, your baby's weight is okay. It's still within normal. But if your baby's weight is going below the lowest line, then that baby is not weight is below normal. If the baby's weight is above the topmost line, that means the baby's weight is above normal and we should worry about it. So that's another way to track whether your baby's weight is okay. Or you can just do simple calculation like, okay, baby double their birth weight at 6 months, they triple it, but those ones are just like rule of the thumb, just to give you an idea. They triple it as 1 year and then quadruple at 2 years and stuff like that. But so there are many ways by which you yourself can, I guess the easiest for those of us who are smartphone users is to just download an app and you can put it on. You can even store it there so you can always see. And the most important thing that the baby's weight should always be going up. It should never remain the same. It should never be static, and it should never drop. So if it remains the same, like the way your baby at 12 weeks or 14 weeks or 10 weeks, and then at 14 weeks the weight is still the same, then that is a red flag for us. That means there's a problem. But if they do it again, is dropping, like it's going down, then that is definitely flashing red and red and red. But if it is going up, yeah, that is all we want. It must always go up. It must never be the flat line. It must never come down. So I hope that is helpful for us. Okay. All right. Omo, what was that? Omobola, I hope you are happy with the answer to your question. Yeah. Okay, so we are here still. If you have any question, feel free to ask your question. Remember the good things to do to keep your children healthy. Breastfeeding, we've talked about that long enough. The whole of last week we talked breastfeeding. Please remember immunization as well. Let's take our children for immunization. Even though I know some of you think, oh, but we've not been having this disease anymore. Should we still be immunizing the children? Blah blah blah. And there are lots of misinformation online, but please, our children still need to take their immunization to protect them against these deadly killer diseases. So please ensure that you take your child for immunization. Yeah, okay, but okay, yeah, you worry that your baby is gaining too much. No, I won't say it's too much. So there are always things are always averages. So some can be a little bit so when we say this is the average, it's just the average. So some babies will gain a little bit more, some people will gain a little bit less, but as long as the weight is still within the average, so we are not all the same. So that's why everybody, our height is not exactly the same, or that our weight is it. So we're all different a little bit, and that is still normal. So we worry about the extreme if it's going off like below. That's why I said that's why the lines are like that, because the lines give you idea of the different centiles. But for if you just use absolute figures, it's either is it normal or not normal. But the lines can tell you it's getting closer to the upper, or it's moving closer to the lower, or it's moving closer to the middle. But the most important thing is that is the child is still within normal, and that is fine. You didn't tell us how you are feeding your baby, so that's I think that's more important. So please, we recommend that you breastfeed your baby exclusively only, and that's all. Oh, finally, I have my first person on Instagram, Kemi Simon. I hope I got that right. Yeah. Okay, say my 2.5-year-old baby girl still breastfeed. Yeah, that's fine. There's nothing wrong with that. When we say breastfeeding, we say breastfeed for 2 years and beyond. So you can breastfeed for as long as you are comfortable to breastfeed. So I know people that breastfeed their 4 or 5 year old. I'm not saying it's necessary or you should do that, but we definitely don't have any problem with it at all. Okay, I've been trying to stop her. How can you stop her? Okay, so that is winning your child. Okay, it's not difficult to stop a child from breastfeeding, but I guess the most important thing in the equation is you yourself as a mother. Are you ready to stop? Because I find that most time is the mother who is not ready to stop. And because if you yourself you are not emotionally ready to stop, it's going to be hard then, because you're going to be easily moved by the child's crying and tears and stuff. So the first thing to make sure is that child is eating. A 2 year old should be eating everything everybody is eating in the family. You should be eating straight from the household pots. So that's number one. So when you want to win a child, you make sure that child is well established on family diet. The child is eating all food, even a 2 year old should be feeding themselves with spoon. All right, so that's the first thing. Then what we normally recommend is to do a gradual approach of dropping, instead of some other just want to do it like a cut and dry kind of method. You just stop and that's it. No, it's better to gradually, wean off the child. So for example, you start, if you are breastfeeding throughout the whole day, you're breastfeeding morning, afternoon, and night, you may decide to stop the morning breastfeeding. Then you may decide to stop the afternoon breastfeeding. So no breastfeeding in the morning, no breastfeeding in the afternoon. Then the night is usually the last to go, and then you want to stop the night. Then once you're ready to stop, you need to have a crisis point, like today's the day for stopping, and that's all you need to do. Some people take the children maybe on holidays to grandma, or to family friends for a weekend, and that make it easier for some. So by the time the child comes back, they've forgotten about breastfeeding. Some we just said that I'm stopping, and that night you don't just breastfeed. You may have your partner, if the child wakes up to cry, you can give a drink, water, milk, whatever. You just have made up your mind that you're not going to breastfeed, and it's going to be hard. But usually if your child is already established on well family diet, we expect the child to be sleeping through the night and all that. So 1 or 2 days, most of them, they'll be fine. All right. For yourself, you need to make sure you wear firm bras so that your breast will be full. And that's where the temptation comes in. Mothers feel like, my breast is too full now. I just feel like breastfeed. No, you don't go and breastfeed the child. You can express a little bit out and throw it away. You can put what we call warm compress, like you put towel in warm water, squeeze it out and just place it on the breast. That will help the the milk to flow out without giving you so much pain, at least to decongest it a bit. You can take painkillers and all that. Some doctors prescribe diuretics for their patients. You can't buy that over the counter. A doctor has to prescribe it. It will dry up a little bit of the breast. But whether you use that, as long as you're taking painkillers, wearing firm breast, not breastfeeding, within 2-3 days, your breast will dry up because breast milk is demand and supply. So if you don't put a demand on it, then the production will stop. Just make sure you don't fall into the temptation of rushing to breastfeed the child again when the child starts to cry, because that's what normally happens to most mothers. They psychologically they are not ready, but once you're ready, you're ready. It's just stopping is stopping. It's just knowing what to do when you stop, how to handle the pain, how to handle the heaviness of the breast, how to handle the crying child. Once you're able to navigate all that, then you'll be fine and your baby will be fine. I hope that means that's helpful for you. And if you want, we have a article on our website actually. But like I said, our website is under construction now. They are doing some behind the scene work on it. So by next week, you can check our website on simple tips for winning. Some people say cabbage leaves helps. Different people say different things helps them, but the most important thing is take care of the pain, take care of the heaviness, wear your fan bra, and you'll be fine. All right, I hope that's helpful. All right, Facebook. I don't think there's any questions still on Facebook. So, Instagram, welcome, welcome. Feel free to ask your questions. We still got like 20 more minutes to go, and then we can wrap it up. But if you are coming later on, remember you can post your questions on our Facebook group, and we'll try and answer it for you. All right. Just to remind us, breastfeeding it's okay if you want to breastfeed beyond 2 years, but we recommend 2 years, and that's what WHO recommends. But apart from breastfeeding, let's ensure we give our children immunizations. Follow whatever schedule is available in your country. There are countries, different countries have different schedule based on what diseases are of issues to them. And for other countries too, we're also trying to expand. Like in Nigeria, we are always expanding. When I started ATP, I think we are stopping immunization at 9 months. Then now it is 15 months, and now we're even going to 9 years. So things keep changing. So the only thing constant in life is change. So let's just remember to go and remember that even though these immunizations are free, they are very costly. Somebody is paying for it, so the government pays for them, but we are getting it for free. So let's not take it for granted. And then I do get a lot of people asking questions about immunization so expensive. You don't have to take immunization in private hospitals, please. Go to the health center. That's the best place to take immunization, and it is free of charge. FOC. All right, Instagram people are here now. Anastasia. I'm not sure I'm pronouncing that well, but you sorry about that. Okay, so please, my daughter of 6 years is always complaining about vagina itching. What can I give her? Thank you for your question. The first thing you can ask your question. Just keep asking all the questions. So the first thing is not what to give her. I mean, always beat peeves when people ask that kind of question. The most important thing is not what to give. The most important thing is to know why. Okay, so a lot of mothers we are always focusing on, is there anything magical I can just give and every problem will disappear? It's always not like that. And even sometimes in pediatrics, we don't have anything for you to give. So we try to understand first why. So I want us to always change our mindset from the what to give to why is happening. That is the first question we should be asking. Why? Why is a 6-year-old itching her vagina? There are many reasons that can explain that. I think the first thing we need to start from is the hygiene. Okay, is a child changing her pants, and then sometimes some of us assume the children are doing it. We have to monitor them, so you need to make sure they are wearing cotton panties, and you make sure it is changed. Even sometimes some need to change it twice daily if they are very busy type that are very, they play all over the place, roll all over the floor. Sometimes they need to come back from school and have a bath and change their pants. So you need to make sure that is happening. That's number one. Number two, how is she cleaning up? Most of the time the infection or the germs get introduced when children clean up after they use the toilet, when they do the number two. For girls, we need to teach them how to clean. They need to clean from the front to the back. Even some adults don't know that. We just, when you use the toilet, we just clean. No, you have to clean from the front to the back, because the front is where the vaginal opening into the vulva is. That area tends to be sterile. It's an area, not much of dirty stuff. But the back, where the poo and all those stools come from, tends to be dirty, full of germs and bacteria. So if you wipe from the back to the front, you are going to introduce the germs in the back to the front area, and the child is going to have infection. But if you wipe from the front to the back, that is okay. So we must teach our girls to wipe from the front to the back. Number two, some girls are actually sensitive or allergic even to the toilet roll. I'm telling some children are allergic to all those things. So even it could be from that she's allergic to even the tissue that she's using to wipe. So some people have to use water and not tissue. So that's another thing. Another thing that can happen is worms. Sometimes worms come out from the back and they go to the front and they irritate the vulva area or even go into the vagina, and they cause what we call vaginitis, like inflammation around that area, and the child will be itching. So you want to also make sure this child is not having worms. You have to do worm. So the first thing also, looking at the area, any infections. Children can also have infection as well, especially if they like, based on all the things I've said, if they're not paying attention to hygiene and all that. So, and then they will have discharges, and they can. It doesn't necessarily mean they've been abused. It's just from not properly taking care of their area. Changing their pants, wiping properly, cleaning up after they put. Some don't even clean up after they put. They just go away. So those are things for a 6 year old. We still have to support them. They may not be able to do it properly. You have to monitor them, and most times schools they don't. So we as the mothers, we still need to check them at home. And then of course abuse is always a possibility. Sexual abuse. So these are the questions we will be asking, checking. And so before you even come to us, you may want to do your own little triage. Check. And I always recommend no silky panties, no polyester cotton, so that you can breathe. And avoid children wearing all these tight jeans and stuff. It doesn't help that area as well. So these are little things that you can do. Deworm every 6 months. So all those things, make sure the hygiene is taken care of, the cleaning up is taken care of, the deworming is taken care of, all that. Sometimes the itching will just go away with doing all that. But if the child is still itching, then you have to see a doctor. We can look if there's an infection, inflammation, we can treat the child for that. And we can also ask questions to make sure the child is not being abused as well. So those are the things that you can do. Anas, I hope that's helpful. All right, Kemi Simon say I have another question. Please ask your question. Akbayemi say, Ma, how should my children deworm? There are worm expellers. The worm expellers are over the counter drugs. You don't need a prescription from me or any of my colleagues. Just go to the pharmacy and tell them you want worm expeller. There are different brands. I tend to favor albendazole. Bendazole, there are different brands of it, but it comes at 400 milligram. 400 milligram at once from anybody who is 2 years old and above, whether it's adult or child. 2 years old, it is 400 milligrams, the same dose, and you give them at once. You can give tablet, you can give liquid. If it's a liquid, sometimes it comes at 20 mils or 10 mils, but everything is 400 milligram. The child just drink everything at once. For older children, they can take the tablets. So it can be one tablet that is 400 milligram. It could be two tablet that is 400 milligram. That means one is 200. So what that is that the child takes it, and you can deworm them every 6 months. So I usually tell mothers it's easier to do it maybe like the beginning of the school year, or you do January, June. What works for you, what will make it easier for you to remember. So every 6 months you can deworm the children. All right, I think I've answered all the question on Instagram. Kemi Simon, please ask your question again. Okay, it's like Facebook people didn't have more questions, so it's this Instagram section now. Let's go back to Instagram there. Okay, thanks a lot, Anastasia. Yeah, thank you for asking. That question is very important, but most of the time it's just so simple stuff that we need to deal with first before we start looking for the big stuff. And all the things I've mentioned, most of them don't require medication. It's just sorting out. The only thing that require medication is the wormy, or if there's an infection. And usually for infection there'll be a discharge, there'll be smelly discharge, it'll be foul smelling, and those are the ones that worries us a lot. And those are the ones that will require you to give something. Others may not require you to give anything at all. So I hope that's helpful. All right. um I still got 10 minutes more, so feel free to ask your question and I will try to answer them before I leave. Um, okay, seem like Instagram, people move to Instagram. I hope there's nothing wrong with Facebook. Very unusual for us not to get question on Facebook. All right. If you have questions, feel free to ask. And I'll do my best to answer. Okay, Kami is asking our second question. What can I do to a child who is now 13 years old that didn't complete his immunization when he was a baby? Okay, yeah. It depends on what immunization was mixed. You can always give what we call catch up immunization. So there's always a room to catch up on immunizations. So there are certain immunizations that the child will always need, no matter their age. So, for example, BCG. BCG is for against tuberculosis, to protect against tuberculosis. So, if your child didn't get BCG at birth, no matter their age, you can always go and take it for them. Um, Things like hepatitis B, because the risk is still there, so it would be nice to take them. But things like rotavirus, for example, is something that is peculiar to children under the age of 1. So usually it's not a problem for older children. So if your child makes rotavirus at 13, we will not repeat that. But things like hepatitis B, measles, BCG, even the DPTs, the penta vaccine, we will still give, because those are things that can still happen. So, uh, what I recommend is, if you have do you have the child's immunization card? If you have the child's immunization card, just, the ones the child has taken, go to the health center, tell them my child took this and this. Then they will tell you the ones that the child can take. We can always give, and we sometimes we can give all of them in one day. I know some parents are worried that, if we give all the immunization in one day, maybe something will happen. Nothing will happen. So we have what we call missed opportunities. So when we see the child, it's an opportunity for us to catch up and to give whatever we need to give straight away. So just go and ask them at the health center. When you get there, they will be able to um work out what the child needs to take, and then they can give the child as well. I hope that's helpful. Yeah. I know some health centers can be, some people, they may not understand more. So if you are struggling with such health center, just go to the immunization within general hospital or teaching hospital, because they have doctors in those places who can always obviously understand. And we have community, we call them community doctors. They are, I'm trying to remember their full name now, but these are the specialists when it comes to things like this. So they will definitely help you to make sure your child gets it. So if you struggle with the health center, because some of our health workers, they are located health workers, and they may struggle to know that just go to a general hospital, a teaching hospital, you have doctors there, and they can always make sure you do it. So it's okay. Don't you don't have to beat up yourself. Now that you're aware of the importance, take your child and we'll still give the immunization. Okay, Kwayemi say, what's your take on supplements for autistic children? What is my take? Okay, okay. I'm actually a neurodevelopmental pediatrician, so that is actually my field. That's my specialty, taking care of children with physical and developmental disabilities, including autism. So I'm a scientist, so I think like a scientist. So in other words, scientists, we need evidence to do something. We don't just do things because it's good to do them. So there must be evidence. So when it comes to autism, we don't have a specific drug as of today. This almost 7 p.m. Nigerian time on the 12th of August 2024, we don't have a drug. Tomorrow there may be a drug, but at this evening there is none. So when it comes to supplements, my what I normally tell my parents is this. I'm okay with parents trying whatever they want to try, but I always like to give them some guidelines. Number one, those supplements, there is no evidence that they're going to cure autism or do anything to autism, because a lot of parents are really looking for cure. They want something that they give the children and everything will go away. There is none. So don't, and unfortunately people that market things like supplement, they are not bound by the medical ethics that ban people like us, so you can't advertise or tell lies. So but some of them will, because they want to sell, they will tell you if you give it everything will go away. It is not true. Everything is not going to go away. So there's nothing like that. That's number one. So I want parents to have the right expectation, number one. Number two, I always group those complementary or alternative therapies, as we call them, into two. There are some that they don't cause harm, but there are some that could be harmful. So, for example, if people say give vitamin C or give vitamin B or give omega 6, so these are normal vitamins anyway, which is okay to take. So, even though we know it's not going to cure autism, but it's still okay to take vitamin C. It's okay to take omega 6, omega 3, whatever. But there are certain things people will say you should take that it's not only that they are not going to do any good for the child, they are actually extremely harmful. So people talk about they say when they want to remove heavy metals, they want to decolonize the gods, all sort of stuff. And I've seen, and I'm not talking only just theoretically. I've seen parents who have gone through all these things and they came back and they were very upset, and sometimes their children even became ill from those treatments, and we have to treat the child again. So I would say discuss first with your pediatrician anything you want to take. So if you want to go on gluten free, casein free, I'm okay with that, as long as the child is eating other things. If your child is very limited and is only eating bread and you want to go on gluten free or casein free, you run into trouble, because malnutrition is what will finish the child, not the autism. So, but if a child is eating everything and you say, okay, I don't want to give sugar, I don't want to give milk, I don't want to give gluten, it's okay, that's fine. You can try that, as long as you are aware that it's not going to cure your child. Or I want to go on vitamins, I want to go on omega, I want to go on which is the other one that they normally like to give. It's okay to try those ones. They don't cause harm. Giving vitamin B or omega or folic acid, but it's fine. But be careful of all these heavy metal chelators, all these other products. Stem cell therapy, there's no evidence that it works. And those things, some of them are so expensive, they impoverish the parents and they're not going to do anything. Whereas the things that at least we know can help the child, like your speech therapy, your behavior therapy, I'd rather you spend your money on what has evidence rather than what does not have evidence. So that is my take. So I'm not completely telling parents zero, don't do it. Okay, because we also don't have all the answers. Yes, we're still doing a lot of research. We don't have all the answers, but as of now, we don't have any evidence treatment. So if you want to do anything, number one, have a realistic expectation. Number two, that it may not work. Number two, make sure it's not going to harm your child. If you are not sure, ask your pediatrician first before you use it, because we know some of these things that have people have used and they have caused problem for their children. So that is my own take on that. If your child is hyperactive, we can treat. Some children have autism and they have ADHD in addition to the autism. So we have drugs for ADHD that we can give. ADHD is treatable, so if you have to see your pediatrician if there are hyperactivity. So there are certain things we can treat with drugs. We can treat hyperactivity, ADHD. We can treat some behavior issues, like some children are hurting themselves, self-harming and all that. We can treat those one with some medication. But the autism itself, core autism, we don't have any drugs for it. So it is always good to work with your developmental pediatrician, your pediatric neurologist, your psychologist, or your psychiatrist before you do anything whatsoever. Opayemi, I hope it's helpful. Just let me know. We can always talk more. Okay, BB. So yes, so my baby is with Qatar, 3 month plus. Yeah, you didn't tell us the question, but if you are just asking what to do, most cancer in children 3 months old are due to viruses. They're going to go away. You don't need to do anything about it. Make sure you're breastfeeding your baby. Clean the nose. If the catheter is flowing out, that's okay. If his nose is blocked with thick mucus, you can apply saline drops and it will help the mucus to flow out. Otherwise, there's nothing to do. Most of the time, it will go away by itself. Okay, Facebook people are back. Oh, Jessica Young. Hello, Miss Gbemisola. Sharing for you. It's been a while with you, man. Thank you, Jessica. Nice to see you too. For last Friday, say good evening. I've treated my 1 year old baby for cough with vitamin C. She's coughing and having cancer. Okay, vitamin C is not the treatment for cough. Vitamin C is not the treatment for cancer. I know people do a lot of things. So when people give their children vitamin C, it's not going to treat the cough. It's not going to treat the cancer. Vitamin C is just a vitamin, but it gives the child ability. It boosts the child's immune system. Is the child immune system that is going to fight the virus. But when you give your child the vitamins, it helps the child's immune system to be able to work. That's all. But the vitamin C itself is not a drug to treat cough or catarrh. So the way you ask your question, you think you are treating cough and catarrh with vitamin C. You are not. It's not a drug for treating cough and catarrh, and we don't expect you to be treating anything on your own. Okay, number one, that's number first thing. And number two, like I said earlier, most cough and catarrh are due to viruses and they're going to go on their own. It's not you that is treating it. They will run their course. The body's immune system will overcome the virus and get it rid of it. But usually they should do that within 1 to 2 weeks. So if your child is still coughing beyond 2 weeks, or the child has fever with the cough, or the child is having difficulty with breathing with the cough, and the catarrh, then it's most likely not a virus. It can be a bacterial infection. In that case, you have to see a doctor so that we can treat the bacterial infection, because those one will require antibiotics and all that. But if it's virus, most of the time they will go by themselves and you don't need to do anything. All right. Jessica is saying, does ADHD cause speech delay? No, ADHD does not cause speech delay at all. ADHD, speech delay, they are separate entities, okay? And when can it be detected? We diagnose ADHD from usually age of 5. So there are those conditions, ADHD, speech delay, they are not like malaria, they are not like bacterial infection that you do a blood test and then you will detect it. They are not like that. They are things that they are diagnoses made based on what we call clinical evaluation, based on observation, based on the child ticking certain number of criteria. So there's no blood test we're going to use to diagnose ADHD, but there are certain observation we can make. There are certain criteria the child has to tick, and if the child is able to tick certain number of those criteria, that is how we make those diagnoses. And I know sometimes it can be very confusing for parents when it comes to developmental disabilities and stuff, because they all look alike, they all kind of run into each other. It can be very confusing, which is why you need your specialist to do it for you. Don't self-diagnose ADHD, speech delay, autism, all of them. They can look alike sometimes, but the specialists, we know how to look for those criterias and how to separate them from each other and know which one is which. So that is what I will say about that. All right. Jessica says it's normal for a 2-year-old to say make single word. We expect a 2-year-old to be combining two words together. So my rule of the thumb that I normally like to teach parents is a very simple but a little bit overgeneralized, but it's the easier way to remember. A 1-year-old should be saying one word, single words. A 2-year-old should be saying two words, phrases, two words combined together. A 3-year-old should be saying three word sentences, three words combined together. A 4-year-old should be talking like an adult, grammatically complex, correct sentences. That's a 4-year-old. I should have no difficulty understanding a 4-year-old as a stranger, So that is how a 4-year-old should be. So your 2-year-old should be combining words together. And if this 2-year-old is not doing that, please see a speech therapist and they will take it up from there. Okay, Payami is saying, how do you join us for a meeting? Okay. We don't do like meetings one-on-one with people, but we offer consultations. So if you check on our group, there are contact details are there. I don't know whether it's on my back, but if you send us a DM or something, we'll send you the right message on how to book appointments or consultation. I'm sure you can do that. All right, thank you. People always come towards the end, but well, we've managed to get through. Thank you so much for joining me. But like I said earlier, for those of us who are just joining, if you still have questions, because our time is up now, we're going. But if you still have any questions, feel free um, to post your questions um, to our Facebook group and we'll be able to answer the questions. But next week, Monday, by God's grace, we'll still be here to answer any question. But you don't have to wait till Monday. Just go to the Facebook group. And if you are watching the recorded episode, please go to the Facebook group as well. Post your questions there. Myself, my colleagues will be there to answer your questions. And Thursday, watch out for another teaching on ATP Hour. And if you want more information, please check out our YouTube channel, check out our website, our podcast, check out all our social media, and do follow us on Facebook, on YouTube, on Instagram, everywhere. And you will be learning a lot. Thank you so much for joining me today. Have a wonderful Monday evening, and I'll see you same time next week by God's grace. Bye-bye. Bye.